I'd like Dr. Khemani to speak a little bit to his experience most recently doing telehealth appointments. How's that been for you in your practice?
Yeah, happy to talk about that. Well, we were not doing any telehealth before the pandemic. So this pandemic, as your audience will tell you, really ushered us, actually projected us into the world of telehealth and telemedicine. And thus far, it's going really well for my patients, provided they have a good Wi-Fi connection, because I tell them, listen, I want to see your tremor, not the tremor of your video camera or your iPhone, etc. So it's very important that they have a stable connection. And if they do, I really can perform a good tremor exam online. And I've been doing a lot of other telemedicine for other disorders such as Parkinson's disease, etc. So thus far, I would say it's been a very positive experience for me.
Great. Dr. Salima Brillman is also on the line today, and she has been prescribing Cala Trio through telemedicine since August 2019, which was pre-pandemic. So Dr. Brillman, can you share a few little tips about telehealth appointments for new patients that you see and that are requesting Cala Trio therapy, and also just to mention how long it takes for you to do those appointments?
Yeah, sure. So it's very streamlined. The appointments are scheduled through Cala, and it's on my appointment via Zoom, my appointment calendar, and the patients as well. And we get together and have the appointment depending on the person and how much, information they want to share with me. It takes about 15 minutes or so. And I'll do an examination with them via telemedicine, and have them do a spiral, etc. They have a questionnaire that they are to answer some questions prior, and this is uploaded for me. And then that is used in I view that prior, and then if I think that they are that they would benefit from the Cala Trio, then I go ahead and submit that prescription to them, for them rather.
Great, thank you. I know that patients are definitely interested in going to their own physicians to get Cala Trio prescribed. Another question, in the age of COVID, patients can't size, the physician is not going to be able to size the patient with their band. So the question is, can they size themselves? And Dr. Khemani, if you could answer how that would work.
Okay, right. So this is interesting. When I was talking to a prior Cala associate, we had this issue about sizing and how do you size a patient. In the clinic, we have sizing bands. So I can very easily size a wrist. In the past, I've had the patient actually directly communicate with Cala Health, and the bands have been sent to the patient so the patients can size themselves. And that's what I've been doing, and it's been working for my patients. But if there is a better way to do this, Debbie, please educate all of us.
Yes, actually, I was talking to our customer success team yesterday, and they were telling me some of the clever ways that they have people measure. So the first thing they might do is ask the patient if they have their own measuring tape at home. And on the prescription form, there is a ruler that can be used. So let's say you didn't have a measuring tape, but you just had a piece of flexible string or a shoelace. The person could put the shoelace around their wrist and then mark the sides and then place it onto a hard ruler or even on the side of the prescription form, and that would tell them what their size is. And they could report that information to you during a telehealth appointment. So that's a couple of little hacks that we use. And like I said, the Cala Health customer success team has been very successful. They give the patient plenty of time to go find some sort of a measuring device. So if you don't have time during your prescribing appointment, you're more than welcome to have the Cala Health customer success team take care of the sizing issue for you. So that's how we handle that.